Uh, Dr. Gandhi, thanks for taking the time to be with us today on a Saturday.
Thank you.
First and foremost, COVID-19, it's still here in the Bay Area. Can you walk me through, I guess, paint a picture of where we're at right now with both infections, but also the vaccine?
So things are getting better. That's the actual major message. So what happened is we opened up on June 15th. We thought things were great. Alpha was here and then Delta came. What did Delta do? It caused a surge of new infections because it's extremely transmissible and we were open. And understandably, those who were unvaccinated ended up getting sick, unfortunately, and our hospitalizations rose, but they rose at a rate of 1/10 where they rose in our winter surge because we did have high levels of vaccination. We needed higher, but we did have higher levels of vaccination. Now we've seen gradually the cases coming down. They're half as what they were at their peak through the Delta surge. That's where we are throughout the whole Bay Area. We have higher levels of immunity from two reasons. One is a good reason, increased vaccination, and one is a bad reason, which is that fundamentally people got the virus who are unvaccinated and eligible, and it made them immune if they didn't get very sick. And so that immunity is bringing down our cases. Best thing we can do is get our vaccination rates even higher.
Vaccination rates in the Bay Area are higher than a lot of places throughout the country, but could they be higher than where they're at right now? And do they need to be higher than where they're at right now?
Yes, they need to be a little higher, and that's unfortunately what Delta did to us. We were good with Alpha, but Delta needs more immunity. So you're right that the Bay Area's fundamentally got spared the kind of surges of hospitalizations that we saw in areas of low vaccination with the Delta variant, like Missouri, Mississippi, Louisiana, Florida. So we had higher levels of immunity and our hospitals were controlled. And they're starting to come down too, by the way, because cases and hospitalizations lag. But what Delta has told us is our level of immunity has to be even higher. Denmark and Ireland have announced they're fully opening in October because they have reached about 80, they're going to reach 85% vaccination rate. I don't know if that's the magic number, but I think it's close. So we need even higher. Vaccinating right now, anyone who's eligible and hasn't done it is what we should be doing.
Across the Bay Area this weekend, it's Labor Day. People are going out. There's so many events going on. But at a lot of these events, there are pop-up clinics. I'm at one in San Jose today, where there is a pop-up vaccine clinic at this awesome car show. How effective are these kinds of outreach programs in getting people vaccinated?
That is so great. What you just told me, it made me so happy because essentially people are out, like you said, life has been hard. People want to, it's pretty out there and people want to be out, and make it easy, make it routine to get vaccinated, make it like kind of a part of your normal day. And so having pop-up mobile clinics at places where people are hanging out is a great idea. It's exactly what you can do to normalize it. This has been shown in healthcare medicine all the time, that if you bring things like blood pressure, glucose monitoring, just fast ways for people to check in about their health, that things are more effective. And here, this is the smartest thing I can think of, is getting vaccine pop-up clinics. I love it.
Say only 12 people get vaccinated at a vaccine pop-up clinic. Is that worth it?
12 more people is worth it. It's still more. So this is the weird thing about Delta, is that even incremental changes are making it better. So if you look around the world, Ireland and Denmark are the highest levels of vaccination. Delta's everywhere. And they are the two countries that are as close to approaching normal than anywhere. Literally, even Canada's lower, and Canada's not normal and not fully open. It's just so completely directly correlated with normalcy of life of being higher and higher. So anything is worth it. 12 is worth it.
The Delta variant, as you mentioned, I guess, could we say it's slowing down here?
It is slowing down here. It is definitely slowing down here. Actually, in San Francisco itself, we're at half of our peak and half the test positivity rate of our peak through the Delta variant. So we basically peaked, earlier in August, and now we're coming down. This was what the model showed, that by the end of September, hopefully it will be quite low. And it's not just that people are wearing masks inside, it really is immunity. That's the only way to get through an infectious disease. Every history book will tell you this about infectious diseases. It's not about keeping away from each other. It's actually about more and more immunity. Vaccination, vaccination, vaccination.
Is vaccination better than natural immunity?
It is, because I'll tell you this, I do actually think that natural immunity will prevent reinfection. So sure, like natural immunity works. In medicine, why would we ever want anyone to get sick, to have something work for you? We have a safe and effective way to never get sick and to prevent COVID. So yes, it's better. It's just like inherently, objectively, to me, better. It's the concept of medicine. We want to prevent disease instead of treating disease.
As we see Delta cases slowly decline, hospitalizations decline, are we out of the woods? Do we have to worry about new variants emerging and spiking up once again?
You know, I no one can predict that, but I will tell you one thing. There's something about Delta that has made it the most transmissible virus. Like, actually, it's probably one of the most transmissible respiratory viruses we've ever seen. It would be hard to develop a mutation that will top Delta. The most evolutionarily smart thing a virus can do is make yourself more transmissible. It's what evolution says, make more copies of yourself. And I doubt that we're going to get a virus more transmissible than this. And if we have enough immunity, we'll fight it. So all I can think about is I'm hoping Delta is the last of what we see of more and more variants. I don't think it's going to be worse than this. That's my prediction.
What would you want somebody to know who isn't vaccinated yet, who's going out this Labor Day weekend to a festival or a fair like I'm at right now, when there is an opportunity to get vaccinated here?
What I would say is that if 95% of the people in the hospital right now with COVID in the United States, which is probably our best estimate, at least between 90 and 95%, are unvaccinated, please don't risk getting sick, because I, as an infectious disease doctor, have seen how people feel in the hospital and you feel terrible. Don't risk getting sick. There's a preventative, safe tool right there at the car show. Please just stop by there, get your vaccine.
How big of a role do these pop-up clinics play in bringing Bay Area vaccination rates up?
I actually think that they are going to play a big role. This is actually what the Bay Area does best, by the way, is community-based outreach. We knew how to do it in HIV, in STDs. This is a principle that we've always used in the Bay Area. So these kind of pop-up, just get clinics where people are, they're out doing something else, stop by and get your vaccine. I think they're going to play a big role. I think it's super smart.
Dr. Gandhi, is there anything else you'd like to add about COVID-19 in the Bay Area right now?
You know, the one thing I want to say is that every time I try to think of what's going to happen in California, I actually look at the UK, because the reason I look at the UK is they're pretty much kind of neck and neck with us as vaccination rates go. And they fully opened on July 19th, and they're still seeing cases be controlled because of immunity. So I would say we're closest to the UK. We're not, unfortunately, Denmark yet, but watch the UK to know what's going to happen here. And things have been going pretty well.